Once known as adult onset diabetes, type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, which is your body's important source of fuel, of course. There are very effective ways to manage the disease. And here to educate us on diabetes is Dr. Kyle Longo with Empower Health. Good to see you again. We had a lot of response from your last visit, and I know that there's a lot of awareness now about diabetes, and we always think that because of that, people are dealing with it better and that we're trimming those numbers down, but that's not necessarily the case.
That's not what's happening. It's very unfortunate. There's been advances in medical technology that have been wonderful breakthroughs in many different areas of healthcare, but with diabetes, the numbers are getting worse. It's estimated by 2030, half the adult population will be diabetic, which is much more than today.
So what's the problem? Why is that, I guess, is the question.
Yeah, obviously things aren't going right. Things aren't going well. If the numbers are going up, yet more and more people are being treated for the disease. And it all comes back to the approach that we're taking while addressing diabetes. Traditionally, the focus is on blood sugar. And blood sugar is a symptom of diabetes. It's not the cause. So when you treat a symptom of diabetes, when you treat a symptom of anything, the disease progresses and gets worse, and that's what we're seeing happening.
We always like to talk about that on this show when we talk about medical matters, is getting to the source of what causes that, and that's what I think you're talking about here.
Exactly. So if you come into our office, we'll take the focus off of the symptoms such as blood sugar and start to deduce, why are you diabetic? There's testing that has to be done. Usually insulin resistance plays a huge role. That's the cause for most diabetics. There are other causes as well, and we'll figure out what that is in order to help you.
Does this work for everybody? Can you reverse diabetes?
Not in everybody. Yeah, we've been successful in actually reversing and taking diabetics, and by the time they're done treating in our office, not being diabetic anymore. But that can't be done in all cases. In most type 2 diabetics, there's a window of opportunity. There's a time in which if you come in, we can reverse the disease. But when the disease progresses to a point and other complications start to arise, that's not possible anymore. So there's a matter of urgency.
There is, and I appreciate the fact that you would answer that question honestly. And the key is, we don't know unless we get tested and you get in and have a talk with these people.
Exactly. I've got to talk with them. We've got to run a series of tests to find out where they are in the continuum. You know, are they in the beginning stages, the middle, or the end? And then
most importantly, are you in that window?
Yeah, exactly.
Because that's the window of opportunity to make the kind of progress that you want to make.
That's what people come in hoping for. So I like to give good news, but sometimes there's bad news as well.
Okay, all right. What you don't know unless you talk, though.
That's the whole thing, is come in and let's find out.
Thank you, Dr. Longo. Appreciate it. Empower Health is located in Creve Coeur. It's on Ballas Road. And right now, Dr. Longo is offering a consultation, exam, and testing for $39 to the first 25 callers, okay? And you can also register on the website. The number right there on your screen, 314-778-3222, okay? That's the phone number, or if you want to get onto this list via the website, you can. It's Diabetes STL. That's pretty easy. DiabetesSTL.com. Good luck. Thank you, Doctor. Appreciate you being here.
Thanks for having me.
Thank you very much, gentlemen.